Hi, my name is Joe Karan. I'm a 62-year-old male. When I was 58 years old, I was diagnosed with stage 5 kidney failure. Within a couple of days of being diagnosed, I was in the hospital having a port put in, and 2 days later was on dialysis. At that particular time, I visited a nephrologist. The nephrologist put me in the hospital, gave me some nephrostomy tubes and to try to help my kidneys, plus the dialysis helped my kidneys, and I was in clinic for about 3 months. I wasn't really crazy about dialysis, as usual. For most people, we're not. And I really wasn't crazy about being in clinic. People in clinic looked sickly, and I thought that was going to be my future, and I wasn't real happy with that. Fortunately, I had a very good nurse and an excellent dietitian and social worker, and they came to me one day and said they thought that I was a candidate to be able to do my dialysis at home. I was all ears for that, and after going through a few tests, I was able to do my dialysis at home. I was on dialysis for 4.5 years. It was hemodialysis, which means that you're putting these long spikes in your arm that they call needles, but they're way bigger than needles, and it's something you just have to get used to. I did realize that once I went on dialysis at home, I was getting healthier and healthier by the day. I was doing dialysis instead of 3 times a week, 5 and 6 times a week. I was in the comfort of my home. I had my dog at my feet, and my family around me, and my computers, and everything I needed to do. So the mental stress was way less than actually being in clinic and taking time out of your day, 3 days a week to travel and then sit in the chair and pull off way too much fluid because you drank too much. So just overall health-wise, way better to do your dialysis at home if you can. It's been an amazing learning experience for me and my whole family. What people don't realize is how many of us out there are. Right now, 1 in 9 people in America have some level of kidney failure. And our real problem is that it's diagnosed way too late. So our only alternative is dialysis or transplant. Our primary causes of diabetes and high blood pressure, polycystic kidney disease, are all growing, they're not shrinking. We need you to speak to your physicians and be more in tune and more upfront with your own medical care. Don't take an answer for granted. Investigate your medical care. Ask questions. There are no dumb questions. Make sure you ask the questions of your doctor. What does this lab result mean? What does protein in my urine mean? What is my GFR? What does that stand for? Ask the questions so you can become familiar with your own body and take charge of your own health care. Don't rely on other people to take care of you. Rely on yourself. There's multiple resources out there to support you. The last thing I'd leave you with is, if you find yourself in this situation, reach out. Reach out to the National Kidney Foundation. If you're in Florida, reach out to us in Orlando, in Miami, in Tampa, in Jacksonville. Reach out to us and we can help you. And we can be there for you. We can teach you how to deal with it. And you'll have some camaraderie with people that understand what you're going through. If you get this disease, I wish you best of luck, and I know you'll do fine. Stay in touch with us.